I'm Kaylee Abfelter, and these are my audience members, Taylor and Tanner.
This is so awkward.
People often wonder if psychologists would be able to give better care to their patients if they were able to prescribe medications. Psychologists spend more time with their patients than medical doctors or psychiatrists and get to know their behaviors and diagnoses more than anyone. Psychologists should be able to treat the whole person, making doctors more available and more students willing to go to school to help the community due to not having to go to school as long. Several states are already adopting this policy. In these states, Idaho, New Mexico, Iowa, Illinois, and Louisiana, psychologists are already allowed to prescribe medications without having to go to school for psychiatry. Psychologists should be able to treat the whole person. Psychologists should be able to perform the assessment, psychotherapy, and the medication so they can make sure that nothing gets miscommunicated between doctors. Patients who see psychiatrists often report that the doctor demonstrates poor compliance with the recommended treatment plan from the psychologist, according to an article by Karen LeBoy. Sometimes it may be hard to get one appointment to see a professional, let alone having to get 2 appointments for therapy and medication changes. Having a psychologist and a psychiatrist all in one makes for more availability of doctors. It could take weeks to get in to see a psychiatrist, which could interfere with the therapy from the psychologist. If psychologist diagnoses a patient with something new, they may have to wait weeks to start medications due to having to wait to see the psychiatrist, and their therapy will take longer. Sometimes a psychiatrist may not be available in a certain area due to lack of students attending school for psychiatry. Psychologists having prescription rights would make students more likely to choose this path due to not having to go to as much school. Students would be more likely to choose this, and according to an article by Alan Bayard, the curriculum could easily be changed to meet APA standards for psychiatry. Psychologists would not have to go to full medical school since they would only be prescribing psychiatric medications. According to an article in the Journal of Clinical Psychology, the added curriculum would fully train psychologists in how medications are made up and how they interact with the body. Giving psychologists treatment rights would benefit their treatment. Psychologists should be able to treat the whole person, making doctors more available, and more students would be willing to go to school for it and help the community due to having to go to school for less time. This debate is not about having a psychologist expand their services, but to provide better care for mental health patients. And this is my audience again.